I find that parents can go home and spend hours with their kids, but if they're just watching a football game or anything, right, on TV or on their phones and disconnected, does it really matter that they're home? So being at home, even though I was out late working until sometimes 7, 8 o'clock at night, when I would go home, I was 150% present with the kids.
How awesome is that? You are a power dad.
Oh, I don't know about that though.
Hi, Dr. Sawhney.
Hi, Emma.
How are you?
Wonderful, wonderful. Thank you for having me.
So it looks like you're at work at the moment.
Yes. Just finished with patients and going to be working this afternoon. So looking forward to chatting with you a little bit on our short break.
So congratulations, you're here on this show with me because you've been nominated as a power dad.
Wow, that's awesome.
One of the criteria for the nomination was that you could multitask, be great with your employees, but be a fabulous dad as well. And in light of Father's Day that's coming up this month, you have been nominated. I'm going to read you your nomination. It's from Dr. Amin, who's a famous podiatrist in the Inland Empire in California. And she wrote in and said to me, I nominate Dr. Ajay Sawhney, an amazingly loyal, caring, and humble dad.
Wow, that's so sweet.
So now I want to know more about your family first, and then walk us through your business after that. But so how many kids do you have?
So I'm blessed to have 2 children. My oldest, my son, his name is Ashan. He's 16.
Oh, wow.
And 12 months and 2 weeks later, our daughter was born, and now she's 15 years old, Rania.
Oh, wow.
So that's our kids. Romy and I, my wife, we've been married for over 22 years now. So it's been amazing. Yeah, I've been blessed. Great family. I'm very, very blessed.
Very nice. And you're standing obviously at work, and I can see a sign that maybe you can move so that the viewers can actually see what it says. Divine Spine.
Yes, this is our office. We have 2 locations. We're here in Yorba Linda and also in Orange Hills as well.
Okay. What do you do, Dr. Sawhney?
So Divine Spine, this is a computerized chiropractic office. We offer spine and joint therapy without any twisting, popping, or cracking. I love it because compared to traditional adjustments, chiropractic adjustments, it's much more gentle, much more precise, much more effective. And we offer patients corrective care. We seek out the root cause of their problem, try to figure out how the best way to help them and actually make lasting changes. It's been a wonderful journey.
So I love going to the chiropractor because, they crack and they pop. My neck, I work a lot on the computer, obviously, with what we do with SEO2Sales, but computer chiropractic care, talk to us a little bit more about that.
So in traditional adjustments, I'm not trying to take anything away. There's a place for everything. They're also can be very effective. We just have a lot of patients that sometimes where a traditional adjustment may not be indicated. They might have advanced degeneration or arthritis or disc issues that may not be safe to give them a traditional adjustment. Might feel a little too aggressive if they have osteoporosis. And there's other patients that just, quite frankly, don't feel comfortable getting their neck twisted, popped, and cracked. So we offer a wonderful alternative that's very effective.
Oh,
and
wow.
It's basically a treatment wand attached to a computer. What we do is we assess the problem, we take digital x-rays, we figure out what's going on, figure out if this is the right place for the patient, if we can help them. Otherwise, we refer them to the right place where they can get some real help. And if we can, the treatment is completely catered to the patient. It's customized to what they need and what their body needs. And so it's a gentle percussion through an instrument that's held by me, the doctor, right? That goes into the spine, putting motion back into the area,
Hmm.
helping to relax the nervous system, relax the surrounding tissue, the muscles. It's fabulous. You have to see it in action and come and check it out to really understand what it does.
Dr. Sawhney, I started this show because on social media, we often see everyone really happy, they're smiling, they've no pain. I want this to be a lesson that you can share with us. What was the one tough thing where you didn't smile, where things were really tough, and you had to make some tough decisions that had to, that was going to have an impact on you and your business, and then you and your family?
Sure, yeah.
As a power dad, can you talk us through that one tough time that you went through?
So absolutely, it's been over 10 years ago, I woke up in the morning and I experienced what I learned later was benign positional vertigo with pulsatory tinnitus. I could hear the heartbeat in my ear and the whole room was just moving around. And I had no idea what was going on or what to do about it. So at that time, I worked with a few medical doctors, and I also worked at a chiropractic office in a rehab facility. So I worked at 3 different offices: an orthopedic office, a medical office, and a chiropractic office at that time. I went to the medical doctor, actually called him and said, "This is what's going on." He said, "Well, you better come in here. We'll check it out." Long story short, the neurologist was also working that day as well that I went in. So I got a full assessment. I got put on medications, which just numbed my nervous system, which just made me droopy. It didn't help the problem at all, unfortunately.
Right.
So got accelerated. I went to an ear, nose, and throat specialist, an ENT, and I got sent out for a CT scan with contrast so they could see what's going on, what's causing this. They were assuming it was coming from my inner ear. And that's what usually benign positional vertigo comes from. So the CT scan came back negative, and what was proposed at the time was to do an exploratory surgery, that they would actually cut open my eardrum, go inside with a camera, and look and see what's going on. The problem with that was, because I was desperate. I mean, this was going on for months, and I was not getting any better. I was losing time from work. I wasn't able to see patients. Whole life was getting derailed. And this was especially challenging because my children were very young.
Right.
And my wife, God bless her, was decided to be a stay-at-home mom at that time and help raise our children. So very, very challenging. I decided it was a decision to have the surgery, the exploratory surgery. But the problem with the exploratory surgery is that, first of all, it's exploratory.
Yes.
Right? There was no guarantees. And if there was going to be any side effects, which was presented to me by the doctor, that I could have permanent loss of hearing. And if there was an infection, I could have brain damage. So this was a really, really tough and dark time at that time of what to do. So I had seeked out a second opinion. I had spoken to a really close friend of mine, Dr. Gaba, who's actually the founder of Divine Spine in Canada. And so he inspired me to really take a closer look at my cervical spine. I seeked that out, and the whole time, Hema, it was coming from my neck. You're supposed to have a curve in your neck. I had a reversed curve in my neck, which was putting pressure on the nerves that were going to my inner ear that was causing this problem. So I seeked out corrective care, which very few doctors do that, where they're actually making correction in the spine using treatment, home exercises, and stretches. So I seeked that out. I got corrected, and the problem was solved. So that was a huge, huge relief and monkey off my back, cloud over my head that was gone. So I was so inspired at that time with everything that I had experienced with getting everything corrected, because my whole life was being derailed at that time, that I looked closer into how can we actually go in and correct people's spines and actually help their nervous system function. right? And so I looked closely into this computerized adjustment system that we have. I actually flew all the way to Canada to visit Baba's office, the first Divine Spine in Canada. And I was so inspired. So by then I had to make a decision. Do I open up my own business?
Right.
How much time is that going to take away from my family now that my health has been restored,
Right.
which is itself a huge deal? Do I want to take on a business? Well, I decided it was going to be a bit of a juggle, but then I thought to myself, what would inspire my children?
Yeah.
A father that goes between offices and works, right, at different offices, or a father that actually really believes in what he's doing, has his own business, and brings everything together.
Right.
And
Right.
so it was a challenge because you're opening up a new business. You don't, you hope it goes well.
Right.
And fortunately it did, because we helped a lot of people. The word got out. Our word of mouth business, our internal referrals is huge here at the office.
Right.
And it helps. I think it helps if you love what you do.
Yes.
Like I genuinely enjoy, I love what I do, and we help so many people. And I've been able to link what we do here at the office to how that translates to being there for the family at home, right? Because if you're helping people and you're busy and you have a successful business, well, then you can do more things with your family, right?
Right. Right.
You can save for college. You can take nicer vacations. You can actually enjoy the time together. So there's a link. I think you can actually link what you do at work and how you can use that to enjoy the time with your family even more.
Right. Well, where to from here, Dr. Sawhney? I mean, are you going to expand more?
I would love to. I think right now what we just did was open up Orange. So I'm actually starting this process of scouting for an associate doctor.
Nice. Very nice.
That can help us. So I think it's going to be just, let's get our new doctor with our office, get that doctor going, and then it would allow me to step away a little bit more if I needed to spend time with the family without having to close the business, right?
Yes.
And I think expansion is something that's on the table. So
good.
Let's see how that goes.
Well, Power Dad, Dr. Sawhney, thank you so much for joining me today.
Thank you.
If someone wanted to get in touch with your treatment program, how do they get hold of you?
Wow, that's great. So our website is divinespineusa.com. That's a great way. You can see our information. Our contact information is on there as well. The office phone number is 714-695-0232. They can call our office directly as well. And our team will take great care of you and schedule an appointment. You can come in for a complimentary consultation.
Oh, just one last question.
Sure.
Someone just texted me and said to me, do you take HMO, PPO?
So we are not contracted with HMOs, but we do accept PPOs. Okay.
Right.
It just depends on the person's plan. So what we encourage people to do is, if you've got an issue that is bothering you, you're welcome to give us a call. Come in. The consultation is complimentary, and my team will go ahead and verify the insurance benefits as well.
Right.
And so figure out what that all looks like as well. And we respectfully must see a lot of patients that have HMOs in our office as well, because a lot of them don't feel like they're getting the help that they need.
Right.
So they'll actually see us, and we've got treatment plans and care plans that save money, that they do that, because our health, at the end of the day, our health is our most valuable asset.
Right.
I mean, that's truly, without our health, whether we're going into college, whether we're coming into retirement, starting or finishing a career, if we don't have our health, we don't have much.
Yeah. So it's divinespineusa.com.
That's correct.
Brilliant. Well, thank you so much, Dr. Sawhney, Power Dad of 2022. We look forward to catching up with you again soon. Thank you for joining us.
Thank you so much. I'm so humbled. Thank you.